brings together cutting-edge research exploring how humanitarian and public health crises affect diet quality, food access, and nutritional well-being, particularly among vulnerable populations. It also highlights the role of local coping strategies and innovative tools in shaping effective context-sensitive responses. By bridging disciplines and geographies, the presentations in this session aim to inform more resilient, inclusive, and sustainable approaches to nutrition in crisis-affected settings. We have 3 and potentially 4 presentations. Each of the presentations will be for 10 minutes before we move to the Q&A section of around 10 to 15 minutes, where questions will be taken obviously from those of you who are in the room, but also from our online audience. So first, I'll introduce all of our 3 and potentially 4 speakers. First, we have Yanni Armstrong from the IPC Global Support Unit. We have Sharumita Vasudev from Lancaster University. We have Muhammad Asrullah from Wageningen University and Research and the Center for Health Policy and Management. And last but not least, potentially Amaka Naji from the University of Washington. So we're going to go ahead with our first presentation with Yanni Armstrong from the IPC Global Support Unit.
Okay, thank you. I will also say that the reverb and the echo is still there, but I'm just going to have to talk over it. So, ladies and gentlemen, thank you for having me this afternoon. I'm going to talk to you briefly about the experience of the integrated choice classification of use of conflict analysis in security, and how we tried to work with a tool to make sure that the impacts of conflict on food security and malnutrition are better integrated into food security analysis. Next slide, please. So I just want to share with you a little bit from the beginning of the talk that some of the data here on crises and on conflict. This is just a global report on crises, which came out last month, which goes to indicate that 295 million people are acutely food insecure at the moment. This is the 6th consecutive year of increases in that number. And in 11 the most important crises in the world, conflict is actually in that insecurity. So we're talking here about conflicts like Haiti, Sudan, Yemen, Gaza, Sudan, and elsewhere. So more than ever, I guess the sense that conflict is a major factor is critical in our thinking about food security. Next slide. And this is something that is right more and more into the IPC, Integrated Food Classification. And if you're not familiar, this is just a short snapshot of what the IPC does. Throughout the presentation, you will find QR codes in the bottom right corner, which if you scan will take you to the relevant documents you see on the screen. The IPC is the world's accepted standard for classification of food security crises, and it provides a 5-choice scale from 1 up to 5 being famine, 1 being insecure, give or take. And it takes information from a wide variety of sources, brings it together into reports like the one you see on the screen here for Lebanon, which was done earlier this year. It's a consensus building process which brings together expertise from multiple sectors and generates information on populations, where they are, what the causes of that security are. It's rigorous maintained for research technical standards because globally we are open source available to everyone. And I would note also that the has been present in the hands of the years now. Next slide. So the question is really what to do with content in this context. I think in some ways represents a unique subject for the IPC. And the intent here is not to consider conflict analysis in a broad sense in terms of why the conflict is what is driving it, but rather very much focus on the nutrition outcomes from the conflict. This is very much what we emphasize. And the reason that is then better suggest how the situation will evolve, how quickly the situation will evolve, And then that's because we actually not only provide the current snapshot, but also projection of what is to come, and understanding the evolution of this is critical. So we have to design the process of doing this, which benefit from professional analysts, but does not require them. Conflict analysts are, of course, welcome to join analysis as anyone, but they're not always available in context. So we need a tool for generalists. And the other factor that I bullet on this slide is just to say that the IPC has no data collecting capacity itself. It works with available public information. Conflict analysis operate on the same basis. It does not work with any confidential information and secret and protected. Whatever analysis work from would be based on information in the public domain, just as security. Next slide. And for this, we also have to acknowledge that by necessity is incredibly fraught. It has implications, not for the people in the room, but also the complexity of this, which have led to conflict. Conflict itself, manifestation systems breaks down the ways in which they speak to each other to resolve problems when level failed, and they've resorted to try to get their point across. And this can lead to even ostensibly exercises in analysis. We think a lot about how in such a way we don't put anyone at risk, and that we do no harm. These are fundamental principles of the peace response and Next slide. And we start from, and this again, I'm going to move through these slides quite quickly, but for you just to be aware of. We start by defining conflict, and this is crucial because there has been a sense in some of the use of or the consideration of conflict in humanitarian circles that conflict has a certain formality to it, and this has limited people's thinking. What we think here is that we say that conflict pertains to any situation in which organized violence is being used in such a way that it has humanitarian consequences. So parties are using violence as a tool or an approach in order to get what they want, whatever it is that they want. And the consequence of that organized violence is negative humanitarian outcomes, usually for civilians, and we would want to better understand that. Okay, so in this context, therefore, organized violence and conflict can be seen as a hazard, which impacts food security. Next slide. And we go through this a number of ways. Again, for food security and nutrition purposes, the form of the violence doesn't necessarily matter. A market will be compromised whether it is bombed or whether it is sealed off in a siege situation. What matters is that the market ceases to function. We have a little bit of a list here of possible things that possible forms of manifestations of said violence. We acknowledge also that that violence is not gender neutral, but is very specific and encountered and experienced differently depending on your age and your gender. Next slide. And again, we see that armed actors we represent armed actors when we consider any party that is using organized violence to attain any one of these outcomes, and sometimes overlapping. These include issues like territory, people, economic or state resources, natural resources, or control of political systems. And if any of those are having negative food insecurity or malnutrition impacts, they're of interest to us. Next slide. And again, there's some typology here of how armed actors might be engaging, both within the state and outside the state as well. There's a range of different kind of positionings that may pertain here. Next slide. And equally, I think we can consider that there's a number of different geospatial levels at which violence can exist. This can happen at national level between states. It can be subnational, that is within a state, but in such a way that it pertains to the entire country, or it can be highly local. There can be areas of a country which are more prone to organized violence than another, and all of these might have negative food insecurity outcomes. Next slide. So the thing to acknowledge here, and perhaps this is the one that's of greatest interest, is the sense that the organized violence can be both direct and indirect, and it need not be experienced directly in a particular place for it to have negative impacts. People may choose not to harvest or to plant on the basis of anticipated violence, even if there hasn't been any. And that's also something that's important. So we have to consider both the direct and the indirect pieces here. Next slide. And again, some examples here of what that might look like and how armed actors also indeed need to eat and often need to produce their own food. So there's a sense here of also understanding how our armed actors themselves are recognizing food security in their system. Next slide. And then this becomes how we consider these questions within the framework of the IPC. And we set by situating these questions both for the current period and the projection to understand how has any kind of forms of violence affected the food security historically in the historical context in the past 5 years, and what might be the future implications of that. Next slide, please. Here's a list of, I mentioned in my earlier remarks that there's a need to use the available data, and there's a great deal of data information which is available, notably ACLED and the International Crisis Group, both of which are excellent sources for conflict analysis from specialized conflict analysts. So as much as possible, rather than creating our own analysis, we look to these parties to see how they are interpreting matters and take it from there. We also, of course, use the experience of people in context. These then become the questions that we look at within the framework of food security, perhaps more familiar to this audience. The 4 pillars of food security being availability, access, utilization, and stability. There are, of course, also important interactions with agency and sustainability, the emerging 5th and 6th dimensions of food security. Next, please. And these are the questions that pertain to the future, how you would then project, what's going to happen with food insecurity in the context and how that would integrate with conflict. Next slide. And finally, this is the analytical framework for the IPC. This is long established and has been in operational use now for at least 10 years. And the parts 1, 2, and 3 that you see up the left-hand side of the diagram just go to indicate where we see conflict entering the analytical framework and pertaining to food security throughout. Again, the QR code will give you more from the manual there. So I've tried my best to keep to time. I know we have other presenters who are also pressed for time. So asante sana, nimeshukuru. And with those few remarks, I'll try to stick around for the Q&A as much as possible. And with that, I hand the floor back to our moderator. Thank you.
Hello, everybody. Thank you for being here. This is Charumita Vasudev from the Food Security for Equitable Futures team. Today, I'll be discussing some insights from our research on food management strategies of households as a response to COVID-19. Next slide, please. To begin with a brief background of food security and vulnerability in India, the Global Hunger Index ranked India as 105 out of 127 countries, labeling hunger levels in India as severe. This is despite the substantial improvements in nutrition noted on as a result of government programs like the Public Distribution System for Food Grains, the Midday Meal Scheme for Children in government and government-aided schools, and the newly launched Poshan 2.0. Since we will be discussing on food management strategies, it is important to note that 75% of the households operate as nuclear in India and only 25% as joint. Both intra and interstate migration is fairly common, with about 37% of urban workforce comprised of circular migrants. In this background, it was feared that COVID-19 raised serious concerns about the potential setbacks on the progress of Sustainable Development Goals and food security. Next slide, please. In this background, the study is guided by the following research questions. What strategies did families adopt to manage food? Did these strategies impact multiple members of the same family differently? How were these strategies influenced by geographical and socio-cultural location and nature of support available? Next slide, please. Before delving into the findings, here's a brief overview of the methods used for this study. We collected primary data for the period December 2022 to March 2023 in 2 states of India, Uttar Pradesh and Goa. While UP is largely rural and agrarian, and an origin state for migrants, Goa is relatively economically well off and receives migration from almost all the neighboring states. We first collected demographic data based on household roster and then conducted semi-structured interviews based on 3 age-specific interview guides. We interviewed multiple members of the same household. Children of the age 7 and above, men, women were all interviewed. We collected about 400 interviews in 86 households and try to diversify our sample as much as possible by caste, religion, type of family structure, etc. Next slide, please. Next slide, please. We found that the coping strategies of households can be grouped into three major heads. First are the coping strategies or decisions taken at the household level. Second is the support available from the government and how it cushioned or facilitated the household coping strategies. And the third is shared vulnerabilities of rural and urban areas to understand the role of geographical and community interconnectedness in the decisions that the households take. Beginning with the household food management strategies, the first are the immediate responses to scarcity or shock. In our sample, we found that the first response included cutting down on expensive items like meat, milk, eggs, paneer, etc., or shifting to cheaper alternatives and restricted diets. For example, potato was a common full fallback option in our sample. However, as crisis deepens, certain more drastic consumption cuts are made. These can include borrowing for food, skipping meals, or going hungry for an entire day. Scholars argued that what is a routine strategy versus what is a response to shock can be very context specific. For example, in chronic food insecurity areas, skipping meals might be routine, but in certain other areas, this might constitute as an extreme response. The coping strategy of each household is thus related to sociocultural location, economic status, and even ability to perceive and respond to risks. For example, while a migrant family in Goa was able to access a loan by buying groceries from a shopkeeper who originally belonged to their home state of Odisha, some other locals in Uttar Pradesh face greater adversity due to relative isolation and neighborhood dynamics. Next slide, please. Another drastic consumption reduction strategy in certain locations could be maternal buffering. Mothers are considered responsible for everyone's food, so they often compromise their own food and nutrition security to ensure that there is enough for everyone. Women participants in our sample often discussed how they sometimes survived on salt water or sugared water for 2 to 3 days during COVID to make provisions for the children to eat. The next crisis response strategy, which is also discussed in this slide, is how changes to household composition can help people manage a food crisis. The first strategy could be household extension, meaning starting co-residence with relatives or pooling resources and households becoming functionally intergenerational to provide for old and young. And the other strategy could be household reduction by sending children away or to live with households or other adult members moving away to find work. In our sample, we take the case of 3 households from UP who were a part of an extended family and located in closer proximity to each another. As can be seen in the figure, the father of the family passed away during COVID and the daughter-in-law from the household 1 shortly after. Before COVID, the 3 households operated as separate nuclear units. During COVID, the households pooled resources and acted as a joint family, cooking together to save on fuel, electricity, and ensuring that the children did not go hungry. However, when our field work was conducted in February 2023, household structure had drastically changed. After daughter-in-law's death, the mother moved in with household 1 to take up the care responsibilities for the children, cooking daily for them. In household 2, the daughter remarried, hoping for some financial stability with an additional earning member. Next slide, please. Next slide, please. The last household level coping strategy, and often the most extreme one, is the difficult choice between subsistence and long-term sustenance. The first such shock coping strategy is when choice needs to be made between continuing education and everyday food. During COVID, children were often withdrawn from school or shifted from private to public schools. When our study was conducted, girl children had not returned to school yet. Also, while enrolled, children were skipping school for weeks and sometimes to supplement the income as livelihood levels had remained limited. Livelihood opportunities had remained limited. In another such difficult choice, also known as the treat or eat dilemma, is to choose between medical expenses and food. During COVID, routine illnesses often went untreated. Treatments for chronic illnesses were delayed. For example, a father of 4 delayed his back surgery for over 10 months to prioritize wife's earnings for household consumption expenditures. Coping strategies and coping capacity are thus embedded in existing vulnerabilities and structural constraints, and if not supported externally, can have long-term erosive effects. Next slide, please. We thus move to how changes to government entitlements cushioned the shock of the pandemic. First were the tweaks made to the public distribution system, which provides subsidized rice and wheat to eligible households. These allocations were made free of cost. They were doubled per household. Also, to account for nutritional diversification, oil and chickpeas were added. In UP, free rations still continue to be distributed. Second is the midday meal scheme. Since the schools were closed, dry rations were sent to homes of vulnerable children, particularly those of migrants. Other government allocations included cash transfers, doorstep rations, etc. in certain areas. Next slide, please. However, migrant workers were particularly vulnerable in this period. This is because they did not have access to local registrations and so could not access PDF support. Lack of local support structures made it difficult for them to access loans. However, certain civil society groups were active. For example, a private hospital provided cooked meats to a colony for 2 months in UP. Next slide, please. To understand the household coping strategies in rural and urban areas, it is important to understand the differences in experiences and interlinkages. In rural areas, jobs were available because of agricultural related lockdown exemptions. Families, especially agrarian families, had access to grain but struggled to self-produce. Civil society groups were not active in the rural areas, but local social arrangements and support networks were generally very strong. In the urban areas, for migrant workers, there were no jobs, no local support, no stock of grain to fall back upon. This triggered a wave of reverse migration, which had spillover effects in agriculture. Extra members of the families had to be accommodated in this difficult time. In UP, there are a variety of crop sharing arrangements, with certain arrangements more precarious than the others. For example, participants discussed that in arrangements where agricultural workers only contributed their own labor for 1/4 of the produce without sharing the input costs, were the easiest to break, as landholders withdrew from these crop sharing arrangements when the sons returned from the cities, or to save costs and began cultivating themselves. Next slide, please. To conclude, we use a critical understanding of coping strategies framework that suggests that coping strategies are rooted in existing vulnerabilities and livelihood constraints. We see that what is a coping strategy versus what is a response to shock is context and even household dependent. While households adopt numerous strategies based on their coping capacities, government and community support acts as a cushioning effect to ensure that short-term coping does not have long-term erosive effects on the future livelihood prospects and coping capacities. However, this support is not easily accessible to all, particularly the circular migrants, which are the most at risk. Thus, local context-specific understandings can help formulate more targeted approach for future disruptions. Thank you.
Yeah. Thank you. Good afternoon, everyone, and good evening from Indonesia. It's such an honor to represent my team to speak today and bring you to the Indonesian context, where we explore the intersection between food insecurity, depressive symptoms among rural adolescents. Next slide, please. As we all know, the COVID-19 pandemic caused major disruptions globally, particularly between 2020 and 2021. On another hand, an evidence gap map on food nutrition security and mental health found that most evidence come from high-income countries, with only a few addressing how context, program design, and analysis can be combined to inform policies. Next slide. In Indonesia in 2021, our study found that about one in 5 adolescents experienced mental health issues, and nearly half of the adolescents were anemic. Next. So the statistic was the reasons behind of our effort to fill these knowledge gaps with local data through the INHES study. For a brief introduction, INHES, or we call it Indonesian Adolescent Health and Nutrition Study, is an ongoing longitudinal study began in 2021 and still continue until this year and probably also next year. In this study, we focus not only on food insecurity, anemia, and mental health, but also on the broader picture of adolescent well-being in one of the rural Yogyakarta province. If you're interested in more details, I invite you all to explore our website on www.inhas.org, where the study design and outputs are available. Next slide, please. Our data collection combined quantitative and qualitative methods to capture not only numbers but also narratives. In the study, we employed structured surveys using tablets with adolescents and their parents. We measure also hemoglobin using HemoQ and also anthropometry. And we also conduct in-depth interviews and focus group discussion with key stakeholders. Next slide, please. For the sample overview, our study represents nearly 10,000 adolescents in the district. In this study, not only adolescents, we also engage parents, teachers, and community stakeholders just to reflect of a whole community approach to adolescent health. Next slide, please. For the socioeconomic context, many adolescents in our study come from families with the low socioeconomic status, characterized by a limited parental education and stable employment. Next slide, please. Using the total household income as a proxy, we observed that a slight increase in the number of households with lower income during the pandemic. Next slide, please. So when we look at mental health here in the slides, you can see that adolescent girls were more affected by anxiety and depressions. And in our study, interestingly, we found a decline in depressive symptoms between the first and the second year of the pandemic. I mean here from 2021 to 2022. Next slide, please. On the other hand, anemia also increased by about 9 percentage points, with the girls who were more affected. Next slide, please. In terms of food insecurity, we saw a slight improvement after 1 year. It is mirroring the improvement in depression and anxiety prevalence. So we found the improvement of food security, in which the prevalence of food insecurity decreased over 1 year. Next slide, please. And another interesting finding that we found, the rates of overweight and thinness among adolescents were early equal. This also reflects the double burden of malnutrition that Indonesia continues to face even during pandemic period. Next slide. Here in the slide, you can see also about the access to food sources like markets and small shops. For instance, in Indonesia, we call it warung, mobile vendors, and even home gardens. They dropped significantly during 1 year of the study. This slide also shows that the disruption in access may have further complicated dietary choices and mental health outcomes. Next, please. Next, please. Double click. Yes. Please back to the previous slide. Yeah. In our further analysis, we found that food insecurity here was positively associated with depressive symptoms, and that this association becomes stronger over time. And interestingly, BMI set score were inversely associated with depressions. To highlight in our context, this might reflect that adolescents with lower than normal BMI, I mean, the adolescents who were undernourished were more likely to experience depressions. In other words, a higher BMI, when moving toward a normal range, may therefore indicate a better overall mental well-being. Next, please. There are several possible pathways why this is happening in our context. Next. Adolescents experiencing food insecurity face increased stress and anxiety as well, which can be worsened by poor diet. This is also often compounded by emotional distress in parents, leading to harsher parenting and behavioral issues in the children. Next. In another hand, BMI also plays a role. In this context, higher BMI is linked to lower depression scores, and it's very based on the sex. Next. in this context, also malnutrition can also affect brain health through changes in neurotransmitter and gut microbiota, increasing the risk of depression. And next, lastly, anemia is also more prevalent, especially among girls, due to the low coverage of iron supplementation program in the COVID-19 pandemic era. Next, please. ANH overall recommendations consist of 4 main points, but based on these findings, next, please. Based on these findings, particularly in the study, our recommendation is to empower adolescents and their communities by involving them in participatory decision making and capacity building initiatives. Next, please. Lastly, I would like to express my sincere thanks to all collaborations, field research, and community partners involved in the study. For information, all publications, data, and policy briefs can be accessed on our website, www.inhas.org. Thank you for your attention, and I look forward to the discussions. Thank you.
Thank you very much, Muhammad. So unfortunately, our fourth speaker won't be able to join us. And so maybe we could have all 3 online speakers with us with their cameras on, and we take some questions from the floor as well as online. Let's wait for them to. Perfect. Great. Any questions? Do we have any relevant questions to our speakers? Okay. Nothing from the ground floor? Okay. I might ask a question, Muhammad, actually, to start with, as you just finished. You went quickly through the last slide, but can you please tell us a bit more about the policy or programmatic relevance of your findings to adolescent mental health support?
Thank you for experiencing the echo.
No, it's good. It's good. Please go ahead.
Okay. Regarding the policy implication of our study, this is just the beginning, because this is, to our knowledge, this is the first study that's looking at not only food insecurity and nutrition, but also linked to the mental health in adolescents, particularly after the pandemic. So we are trying to kind of involve all the local stakeholders to also not only putting their effort about the nutrition and mental health among adolescents, but also start with the practical implication. For instance, having the local regulations to kind of concerns on adolescent health, not only about the nutrition, because to our knowledge also in Indonesia, mental health, the government now starting to put their effort to improve the adolescent mental health, but particularly in our study, the link of adolescent mental health, not only about the mental health and well-being of adolescents, but also linked to the overall mental health, including overall adolescent health, including the food security and nutrition. So to sum up, this is just for the beginning, and we're trying to still advocate, starting from the one district, and hopefully we can impact to the other district in rural Indonesia.
Thank you very much. Very interesting presentation. My question is to Muhammad. Yes. I just would like to understand the relationship between BMI and mental health. I think, I don't know whether I captured your explanation fairly. What is it? Is it that, this association that you observed, and how can we now link this fight of high BMI with mental health? I think it can help us to combine the two. Thank you.
Okay, thank you for the nice explanation, Deco. But now perfect. Thank you for the questions. In our context, because the adolescents, we are treat the BMI as a continuous score. So we use score instead of like the nutritional status categories. But in our context, if you look at the nutritional status classification or categories, as I mentioned before in my slide, that the nutritional status in our respondents now kind of equally between the undernourished means the thinnest adolescents and also the overweight. So in our context, probably that higher BMI here moving from the undernourished or thinnest to the normal BMI. The possible mechanism is that because adolescents feel like this is just like another findings in another study, but I want to just highlight here that adolescents feel insecure when they feel like they're thin or thinner than their peers. So when they feel like they're thinner from compared to their peer, they feel like insecure, and then it influences their mental health. Based on our qualitative findings, one of the adolescents even expressed that she got bullied when their the body their appearance is thinner than the peers. So that's my also the reasons why then people who were undernourished or not normal BMI status tends to feel insecure and then maybe reflect how you call it have implications to their mental health overall.
Thank you very much, Muhammad. Any questions online? Okay, just 1 second. None online? Okay, please go ahead.
Thank you. My question goes to Charamita. I don't know if I'm pronouncing her name correctly. She presented about food management in households and disruptive events, and she quite elaborated how the families managed to during and post the COVID-19. I just want it just got me curious. I just want to know if there are any implications that or influence that came from the community leaderships, and what was going on. Like, in the context of your study, do you have did the family experience any help or support from the community? Were there any arrangements that were in place for community, and generally issues of bureaucracies and policies around that post COVID-19? It just got me curious in that area.
Hello, thank you for your question. During our study, we've interviewed only households and we haven't talked to community leaders as such. But within the households, talking to them, we know that there were community management strategies. For example, they were pooling resources with the community as well. I haven't talked about it a lot, but for example, the local corner shops or the grocery shops, they were sort of accepting delayed payments or pay when you get paid kind of systems, which are sort of in areas where there are precarious livelihoods. These systems sort of exist in the long term as well. But during COVID, the payments were delayed for like 2 months, 3 months, and people were okay with that. They were letting people buy groceries from the local corner grocery shops. But again, these systems are also accessible to certain people and not accessible to certain people. For example, the migrants don't have these local relationships of trust, so they couldn't access these this kind of help. But people who've been living in an area for a longer period and have established relationships of trust with their neighbors or with other community members, they could more easily access them. And also, I would like to point out that women played a major role in this because they had sort of established these local community relationships, and they could borrow from their neighboring women and sort of engage with them. And if the food wasn't cooked in one household, they could just sort of take food from the other household and feed the children. So women's labor of building relationships really helped during this time.
Thank you. Another question from here in the room. 1 second, please.
Thank you very much. My question is to Jenny. I don't know, Yanni or Yanni. Yanni, yes. It's about conflicts. And what we are seeing globally right now, that there are a lot of conflicts going on from household level to international level. So, with your position, how do we handle this situation? Do we have guidelines or whatever that would guide people on how to address these conflicts from household level in terms of food security, nutrition, health, and agriculture, and everything else that's we see in Ukraine and Russia and the grain conflicts, the food conflicts that we're seeing right now? Food being used as a weapon. Thank you.
Yes, thank you very much for this question. You're absolutely spot on, and it is a regrettable reality that the use of food as a weapon is increasing, and we increasingly see the use of starvation as a, to put it very cynically, very effective weapon of war. I think the thing that there's a few things that we can do here, at least from the point of view of analysis. Indeed, there are technical guidelines that exist. You can find them on the IPC website. We've developed both a reference document and then a sort of series of technical guidelines for how to integrate this into a food security analytical framework. But I must say that I feel this only answers half of your question. The other half of the point is what do we do to better integrate the lived experience of vulnerable populations who are experiencing this day to day. And I think in that, what we can better do is to acknowledge the lived experience of those populations and try to include it in our thinking and our analysis as best as possible. We found this recently in an exercise we conducted in South Sudan, where indeed it's clear that there is a great deal of, again, very unfortunate but very real history when it comes to understanding how conflict manifests and will manifest at different times of year. And we can do well to learn from those households and better integrate what it is. In terms of your specific emphasis on household, I think that varies deeply from place to place. In some contexts, this will require, or this entails, a whole-scale rethinking of livelihoods. In some cases, it entails migration. In some cases, it entails staying put. It's highly variable. And what we can do is be sensitive to the variations from context to context and do our best to have an open, honest conversation about it, no matter what form that violence is taking, that we be there to acknowledge its very real impact on the lived experience of these populations. I hope this answers your question. Thank you.
Thank you, Yanni. Any more questions? Yes, please go ahead. Yeah, we have two questions, so one after the other, please. Yeah.
Okay, thank you very much. My question is to Charumita. Thank you for sharing those coping strategies that were during COVID-19. So my question, what struck me was a comment that you made around that girls have not still gone back to school. So these are some of the trade-offs that were being made during that period. And I wondered, how is that finding being taken up? Because as you can see, this food insecurity is already causing some inequalities. So I just wanted to find out from your experience, how was that taken up and what has been done? Thank you.
Yeah, thank you. My name is Khalif. My question also goes to Charumita. I think one of the findings that you reported in your study was that higher BMI was found to be associated with lower depression.
That question
goes to Mohammed.
Is for Muhammad,
okay.
Right? Yeah.
So I was curious to know whether this was an expected finding from the study, because one would expect a higher BMI to probably be related to higher levels of depression. Thank you.
So Charumita, can you please answer the first question and then we'll move to Muhammad. Thank you.
Thank you for your question. So this entire study is a longitudinal study, and the current data that I discussed is from the first round of study. And we've been to 86 households, and right now this data pertains to narrative analysis of 15 households. So in that, we found that around about three households, sons had returned back to school and daughters had not. And in one of them, the daughter had gotten married immediately after COVID. That is also sort of a coping strategy where you marry off the daughter so that there are lesser mouths to feed within the household. So, and she was married at a young age. So, in our future analyses, we've returned to these households, the same households. So we'll be looking at whether they have gone back to school now, or what is the number of girl children who are sort of not returning back to school with respect to the boys in the school, their brothers who've sort of gone back to school. And this requires further analysis of our longitudinal data, and probably we'll look into the data more deeply to answer your question.
Thank you. Hamad?
Yes. Thank you for the questions. As I mentioned before in my my answer, my previous answer, in our context, we also hypothesize that a higher BMI in terms of like adolescent with overweight status tends to have higher score of depression and anxiety, but it's not happening in our context as I mentioned before also in my presentation, that adolescent in our study also not only overweight, but also there's a couple of, there's also high prevalence of people who adolescent who are teenagers or lower BMI than normal BMI. So we assume that the higher BMI in our study context is adolescent who were teenagers to higher BMI to the normal range, not normal range to overweight. Based on our study also in Indonesian, using Indonesian national representative data, more than 10,000 adolescents, we also found that, as you mentioned before, that as I mentioned also in your statement, that higher BMI tends to have, adolescent with higher BMI tends to have a higher depression score. And we found that in the national representative data, but not in our study, because as I mentioned before, the distributions of adolescents BMI not only in the overweight sites, but also in the underweight side. So it's more into underweight side to the normal in terms of a higher BMI. Thank you. I hope I answer your question.
One more question.
Hi, this is Vayani. Sorry, but you were presenting, the acoustics were a bit worse off than the other two because you were the first one to go. So maybe I missed this. I'm just wondering if you could expound on your methodology a bit more in terms of, you said there was field testing conducted and there were some case studies in Yemen and East Africa, and you engaged with humanitarian agencies and so on. Could you tell us a little bit more about how one would go about engaging in research in conflict-affected settings, and what exactly you tested? Maybe I'm asking a methods question here. What are some of the methods you have used and analyzed? And also, I would like to ask if IPC includes multiplier effects of these various vulnerabilities and conditions. For example, multiplier effects of conflict on climate change, and what does that mean for food insecurity and forecasting of that? Thanks.
Yeah, thanks very much for that. And I apologize for the quality, the sound quality. I can assure you was as bad for me as it was for you. In terms of the questions for the methodologies, for the methodology here, this was extensively in order to answer your question fully, I'm going to have to take a step back and explain a little bit about the methodology of the IPC as a whole, which is a consensus-based framework around a series of technical standards, which involves 21 different organizations worldwide, World Bank, IGAD, UNICEF, WFP, Save the Children, Oxfam. A great number of stakeholders come together with the key local stakeholders in the country and come together to hash out the food security and malnutrition analysis for that place. Why that's relevant is that conflict, in effect, had a preset kind of framework and process into which it would be inserted. as something which within the framework of the IPC is referred to as a contributing factor. Given the importance of conflict, the historical problem identification was that conflict wasn't given adequately rich detail and consideration. So the intent was to give a bit more kind of context and a bit more kind of weight to how it was being treated. This was workshopped with those groups of stakeholders in various places and then was introduced for the first time in a more formal context in the IPC projection update, which took place for South Sudan and was published in early this month, I think around the 2nd of June. So that was the first time that this tool was used more properly. And it worked reasonably well. I wouldn't say that it worked flawlessly. We certainly have some more thinking to do in terms of how we more fully integrate this. And part of the reason for that is your question about the multiplier effect. The way the IPC works is it's very much a consensus-driven process, and that sense of weighting that's given to the contributing factors of a crisis is very much contingent on the views and the expertise in the technical working group in country. And they equally would be the ones who would be in a position to better understand the multiplier effect. So how conflict, for instance, in West and South Sudan, how conflict is intersecting with a very high expected flood pulse this year, which is going to in turn be the result of uneven rainfall in that part of the country. This was a very real consideration. Whether or not, and the confluence of those in the medium term is going to be quite serious. So I think what I'm saying here is that there's a certain amount of that's happening organically at a certain level based on what people are observing and experiencing. But I think you put your finger on a good point in that we could do more to better integrate that multiplier effect. It's certainly something we have a lot of quite theoretical and abstract consideration of, but finding a better way to integrate that in more complex analyses is certainly something that we could do more of. There's time series implications for this. There's also a question of, if a multiplier, what is the denominator? Like, to what extent do you determine the multiplier effects, which are of course bilateral? They're not unidirectional. They will have implications both ways. There can be cascades depending on how you conceptualize the system. So all of which is to say, much more should be done there. We're cognizant of it, but I'm sure we have room to improve. Thank you.
Thank you. Any more questions? Anything online, actually, just to make sure we're not missing those? None? Okay, great. Then, well, we're going to thank all of our presenters for sharing such insightful work. Today's session has highlighted the complex and deeply intertwined relationships between humanitarian and public health crises and the food systems and nutrition, reminding us that nutritional well-being in crisis settings is shaped not only by access to food, but also by structural inequalities and the resilience of the local systems. So, and again, I mean, the research that was presented today offers valuable contributions not only to evidence, but also to practice. And as we move forward, it is clear that addressing nutrition in crisis-affected contexts requires integrated, context-specific, and inclusive approaches. Thank you all for your engagement, and we hope that these insights continue to inform your work. Thanks again, and any comments from your side? Thank you.
No, thank you everybody for making this session very engaging despite the lack of in-person presenters. Thank you for our wonderful chair, our online presenters, and all the participants. We have a side event at 5:50, so you have about 20 minutes for whatever you want to do, and we see you at 5:50. Thank you.